Good day, ma'am. Good day, future RNs. Today, we are here to present to you the topic that has been assigned to us, which is all about collecting of objective data for vital signs. We are from the first group. I am Sherwin Dimacutac, the leader of this group. And together with my group members, Brylle Alipar and Venus Apresto, will be my discussion partners for the vital sign temperature. Crizle Balaba will speak to you about the vital sign pulse. For the vital sign respiration, we have Denesa Joy Brana in collaboration with Farhana Buisan. And finally, we have Jaycell Mae Celebre with Sittie Hairah Sangki. They will talk to you or describe to you the vital sign blood pressure. So, let's get started. Let's start with vital signs. Vital signs, or also known as cardinal signs, is a measurement of the body's most basic functions. The four main vital signs, routinely monitored by medical professionals and healthcare providers, include the following: the body temperature, the pulse rate, the respiration rate or the rate of breathing, and the blood pressure. Fun fact, blood pressure is actually not considered a vital sign, but is often measured along with the vital signs. Vital signs are useful in detecting or monitoring medical problems. That is true. As nurses, vital signs are important to us as this serves as a guide in meeting the needs of the client, also aids in planning of the care for the client, and lastly, establishing baseline values of the patient's cardiorespiratory integrity. So for our first vital sign, we have the temperature. So what is the body temperature? The normal body temperature can range from 36.5 degrees Celsius to 37.2 degrees Celsius for a healthy adult. But let's always remember that the normal body temperature of a person varies depending on gender, recent activity, food and fluid consumption, time of day, and in women, the stage of menstrual cycle. Let's define temperature. This is the difference between heat produced and heat loss. We have two terms here. We have hypothermia, which means below normal. This is when the core body temperature drops below 35 degrees Celsius. And the other one is hypothermia, which means above normal. This means having fever. This is when the core body temperature is excessively higher than the normal. We have two types of body temperatures. First is our core temperature. This is the temperature of the deep tissue of the body, such as abdominal or pelvic cavities. This is also relatively constant. This is measured by taking oral and rectal temperatures. The second one is the surface temperature. This is the temperature of the skin, subcutaneous tissue, and fat. This actually fluctuates depending on the blood supply to the skin and the amount of heat loss to the external environment. This is measured by taking the axillary thermometer or by taking the axillary temperature. Factors affecting the heat production. First is our basal metabolic rate. The younger the person, the higher the BMR. The older, the lower the BMR. Therefore, the older persons have lower body temperature than young ones. To solve your basal metabolic rate or BMR, we have a gold standard formula here, which is equal to BMR equal to 655 plus the 9.6 times weight in kg plus 1.8 times height in cm minus the 4.7 times age in years. Number 2 is muscle activity or exercise. Increased cellular metabolic rate, therefore increased body heat. Muscle activity causes increased metabolism by increasing carbohydrate and fat breakdown. Any form of exercise can increase heat production and thus body temperature. Number 3 is thyroxine output. This is the increase in cellular metabolic rate by hyperthyroidism. So, the thyroid hormones stimulate diverse metabolic activities, most tissues, leading to an increase in the basal metabolic rate. One consequence of this activity is to increase the body heat production, which seems to result, at least in part, from increased oxygen consumption and rates of ATP hydrolysis. The next one is the epinephrine and sympathetic stimulation. So, this means that the adrenal glands dump epinephrine into bloodstream, which leads to an increase in body temperature, thereby burning more calories. And the number 5 is increased temperature of body cells. So it is easily understandable. So we have the processes of heat loss. First is radiation. This is the transfer of heat from one object to another without contact. Example, warm in the crowded room. Second is the conduction. This is a transfer of heat from one object to another with contact. Example, if you were to sit on a metal chair, the heat from your body would transfer to the cold metal. Third is convection. This is the dissipation of heat by air currents. Example, the use of a fan to cool off the body is one example of convection. And lastly is evaporation. This is the continuous vaporization of moisture from skin. Example, insensible heat loss. Now let's move on to the factors affecting temperature. First is age. One of the most elementary factors that influence normal body temperature is age. The influence of age on body temperature is mostly easily observed in the case of children and elderly people. So, for the infant, they are independent to the environment, and for the adult, risk for hypothermia decreased thermoregulatory control. The second one is the diurnal variation. The temperature of the body is lowest in the morning before metabolism and the muscle contractions begin increasing. The highest temperature is from 8 p.m. to 12 midnight, and the lowest temperature from 8 a.m. to 6 a.m. Number 3 is exercise. Strenuous exercise increases metabolic rate and temperature. Number 4 is hormones. We have specific hormones. We have progesterone, thyroxine, epinephrine, which increases the body temperature. And we have the estrogen, which decreases the body temperature. And lastly, we have stress, which is a stimulation of sympathetic nervous system.
A fever is a psychological problem when your body temperature is above the normal range. An elevated body temperature usually accompanies an underlying condition. Types of fever. Continuous fever, where the temperature remains above normal throughout a 24-hour period and does not fluctuate more than 1 degree Celsius and 24 hours. This type of fever occurs in lobar pneumonia, typhoid, urinary tract infection, infective enterocarditis, brucellosis, and typhus. Next is remittent fever. The temperature remains above normal throughout the day and fluctuates more than 2 degrees Celsius and 24 hours. This type is seen in patients with typhoid fever and infective endocarditis. Next is pill abstain fever. There is regular alternation of recurrent bouts of fever and febrile periods, and temperature makes 3 days to rise, remain high for 3 days, and then remits over 3 days. The patients could then be appraisal for 9 days. Intermittent fever in a 24 period the temperature is only present for some hours of the day, and the rest of the time is normal. The spike can occur same time each day, every other day, or every few days, but it is normally an repetitive pattern. Examples of some diseases which have intermittent fever are malaria, pyemia, and septicemia. Next is septic fever, a very high temperature which doesn't improve with antibiotics can indicate a septic fever, and patients should be seen quickly and reviewed to prevent any further de- deterioration in their state of health. Next is cyclical recurrent fever or periodic fever. These are recurrences of fever which last from few days to a few weeks and are separated by symptom-free intervals. This pattern of fever can be used by recurrent infection, malignancy, or non-infectious inflammatory disease. Attack of fever which allow the same course normally have non-infectious cause like Still's diseases disease, rheum- rheumatoid arthritis, Crohn's disease, and Behçet's syndrome. Decline of fever, crisis, flush, defervescent, sudden decline of fever indicates hypothalamus impairment. Next is lysis, gradual change of fever. Clinical signs, symptoms, sweating, chills, and shivering, headaches, muscle aches, loss of appetite, irritability, dehydration, and general weakness.
Temperature routes. Oral or mouth temperature can be taken by mouth using either the classic glass thermometer or the more modern digital thermometers that use an electronic probe to measure body temperature. So the normal values of oral or mouth is 36.5 Celsius to 37.5 Celsius or 52.3 Fahrenheit to 52.8 Fahrenheit. It is most accessible and convenient. Leave in place for 2 to 3 minutes. Tympanic or ear. A special thermometer can quickly measure the temperature of the eardrum, which reflects the body core's temperature, the temperature of the internal organs. So that normal values of tympanic is 36.8 Celsius to 37.9 Celsius or 52.4 Fahrenheit to 53 Fahrenheit. It is safe, good for children, and inaccurate sometimes. Rectal or rectum. Rationale, temperatures taken rectally using a glass or digital thermometer tend to be 0.5 to 0.7 degrees Fahrenheit higher than when taken by mouth. So the normal values of rectal is 37 Celsius to 38.1 Celsius or 52.6 Fahrenheit to 53.2 Fahrenheit. It is more reflective to core temperature and most accurate. Leave in place for 2 minutes. Axillary or armpit. Temperatures can be taken under the arms using a glass or digital thermometer. Temperatures taken by this route tend to be 0.3 to 0.4 degree Fahrenheit lower than those temperature taken by mouth. So the normal values of auxiliary is 35.8 Celsius to 37 Celsius or 51.9 Fahrenheit to 52.6 Fahrenheit. It is safe, good for the children and newborns. For adult, leave in place for 9 minutes. For infant, leave in place for 5 minutes. Temporal or forehead, a special thermometer can quickly measure the temperature of the skin on the forehead. So the normal values of temporal is 34.4 Celsius or 51.1 Fahrenheit. It is safe and easy but least accurate. Conversion, the act of changing into something different form of properties. So this is the example of Fahrenheit to Celsius and Celsius to Fahrenheit. So the example of are the example of Celsius to Fahrenheit to Celsius. Number 1 is convert 35 to Celsius to Fahrenheit. So Celsius times 9 divide 5 plus 32. So first step is divide the 9 and 5 is equals to 1.8. So 35 times 1.8 plus 32 is equals to 95 Fahrenheit. Then number 2 is convert Fahrenheit to Celsius. So first is Fahrenheit minus 32 times 5 divide 9. So the first step is divide the 5 and 9 is equals to 0.55 and the Fahrenheit is 112. So 112 Fahrenheit minus 32 times 0.55 is equals to 44 Celsius. Normal values. Normal values are defined as references for the evaluation of measured parameters. Example, commonly they are given as limits value ranges. Normal are reference ranges within which the measured values of around 95% of representative population can be found.
Pulse taking, definition of pulse, site of pulse, normal values of pulse. Definition of pulse is the rate of the beats. Pulse actually called heart rate, which is the number of time heart beats each minute. In some type of cardiovascular disease, the heartbeat and pulse rate can differ. A strong regular beating or throbbing, the rhythmic pulse of the music, the beat resulting from the regular reddening of an artery in the body as blood flow through it fill your rest for a pulse. Sites of pulse, temporal, site of forehead, carotid in the neck, radial at the crook of the elbow, radial at the rest and the same at the thumb, femoral, inner aspect of upper thigh, popliteal, behind the knee, dorsalis pedis, on the arterial surface, the foot below the ankle joint. Normal values of pulse. A normal resting heart rate for adults ranges from 60 to 100 per minute. Generally, a lower heart rate at rest implies more efficient heart function and better cardiovascular fitness.
Next is respiration. What is the process of respirations? It is the process by which an organism takes in oxygen and release carbon dioxide, one in which the circulating medium of the organism, example the blood, comes into contact with air or dissolved gases. When we hear the word respire, we probably think of breathing. So, every couple of seconds we breathe air from the atmosphere and then breathe out. This is to supply every cell in our bodies with one particular component of atmosphere and oxygen. Our cells need oxygen to perform cellular respirations, which generates the energy we use to think and move around. Without oxygen, we can't produce energy and we don't last very long. Next is types of breathing. First is eupnea, which means normal and quiet breathing. Eupnea that requires contraction of diaphragm and external intercostal muscle. In eupnea, expiration implies only elastic recoil of lungs. Next is apnea, which means cessation of breathing. This is a potentially serious sleep disorder which breathing repeatedly stops and starts. If you snore badly and feel tired even after a full night's sleep, you might have apnea. Next is hypernapia, which means abnormally increased rate of breathing. It's more air than we normally do. It's our body's response to needing more oxygen. And next is chain strokes, which means respirations gradually increase then cease entirely for a few seconds. These are a rare abnormal breathing patterns that can occur while awake but not usually occurs during sleep. And next is rails, which means rating, gurgling sounds heard with breathings. This is a small clicking, bubbling, or rattling sounds in lungs. Kapag maririnig natin ang tao na humihinga ng malalim, ito ay rails breathing. Next is hyperventilation. Depth and rate of breathing are increased, which means rapid breathing usually caused by anxiety or panic. This overbreathing, as it is sometimes called, may actually leave you feeling breathless. And lastly is hypoventilation, which means slow and shallow breathing. This is too slow to meet the needs of the body. If a person hyperventilates, the body's carbon dioxide levels rises, and this is a cause buildup of acid too little oxygen in the blood.
Good morning everyone, my name is Farhana Buisan and now we're going to talk about the types of respiration. So what are the types of respiration? There are three types of respiration: the internal respiration, external respiration, and cellular respiration. Internal respiration is an exchange of gases between the cell of the body and the blood by way of the fluid bathing the cell. External respiration exchanges gases between the lungs and the bloodstream inside the lungs. Cellular respiration, any of various energy-yielding oxidative reaction in living matter that typically involve transfer of oxygen and production of carbon dioxide and water as end products. Next, what are normal values of temperature? Normal body temperature varies by person, age, activity, and time of day. The average normal body temperature is generally accepted as 98 Fahrenheit degrees Fahrenheit or equals to 37 degrees Celsius. Some studies have shown that the normal body temperature can have a wide range from 97 degrees Fahrenheit or 36.1 degrees Celsius to 99 degrees Fahrenheit or 37.2 degrees Celsius.
Good morning everyone, especially to you ma'am. My name is Jaycell Mae Celebre and I will be going to report about blood pressure. So what is blood pressure? Blood pressure is a measure of the force that your heart uses to pump blood around your body. The importance of blood pressure. High blood pressure is a risk factor for heart disease, stroke, kidney disease, and dementia. High blood pressure can also be hypertension. And if your blood pressure is consistently more than 140 over 90 mmHg, then you have a high blood pressure. The normal blood pressure. The normal BP range is 110 to 140 over 70 to 90 mmHg. For example, 120 over 80 mmHg. As you can see at the image above, the 120 is the systolic pressure and the 80 is the diastolic pressure. Another example is 130 over 80 mmHg or 130 over 80, the top number called systolic pressure. Its definition is the pressure on the arteries after your heart pumped out blood through them. And the bottom number called diastolic pressure. The diastolic pressure is pressure in the arteries when the heart relaxes. As you can see in the picture, the 130 is the top number and the 80 is the bottom number. As you can see in the chart, this is the normal blood pressure by age.
Blood pressure is a measure of the force that your heart uses to pump blood around your body. Blood pressure is known as the pressure of circulating blood against arteries. The heart pumps the blood through the circulatory system, which causes the majority of the pressure. The word blood pressure refers to the pressure in the major arteries when used without qualification. Normal values. Normal blood pressure for most adults is defined as a systolic pressure of less than 120 and a diastolic pressure of less than 80. A systolic blood pressure is a pressure exerted when blood is ejected into arteries, while diastolic blood pressure is a pressure blood exerts within arteries between heartbeats. Putting the cuff over clothing rather than a bare arm can add 10 to 40 millimeters of mercury to a measurement. Having a full bladder can tack on 10 to 15 millimeters of mercury. Failing to support the arm at heart level can add 10 millimeters of mercury. An unsupported back can increase a measurement by 5 to 10 mm of mercury. That same range applies to feet dangling from an exam table or high chair. Crossing legs means extra 2 to 8 mm of mercury. Blood pressure contraindication. Following are some relative and absolute contraindication of measuring blood pressure. Lymphedema, paresis or paralysis, and arterial. These are relative contraindication for taking blood pressure on the affected arm using a cuff. Dialysis shunt, recent surgical wounds, mastectomy. These are absolute contraindication for taking the blood pressure on the affected arm using a cuff.